Good morning, everybody. Happy Aloha Monday. It's Dr. Gupta on Maui, and I promised the sweet mom at the Maui Ocean Center that I would do a video on how to get our kids to brush their teeth and floss. So the first thing I have to say is that there was one mom who told me, I just can't floss my kids' teeth. It's so hard, so I just don't do it. And I would answer to that, how hard do you think it is to get this into the child's mouth in the dental office? Yes, we as dentists struggle to numb our patients up, giving them the injections to fix the cavities that are caused by not flossing. And yes, cavities do form when we don't get between these teeth, even the baby teeth. You have these two little baby teeth that come out. And yes, you do need to floss between those teeth. So I just finished my morning workout, so I'm a little sweaty, but I wanted to do this talk real quick to let you guys know my tips and tricks that have worked for me and my patients for getting our kids to brush and floss. So the first thing is make it fun. Get a timer. Kids love timers. They love little activities, whether it's the little sand timer or the electric clock timer, whatever you need to use, make it fun. Hey, what do you think? Give them options. What do you think? Should we start with brushing today or flossing? What do you think? Should we start with bath time today or flossing and brushing? What do you think? Should we skip a day of brushing and let cavity bugs eat our teeth all night? What do you think? Hopefully the kid will say no. But these are ideas to make it fun and empower our kids to have a decision and a choice in the matter of brushing and flossing so they understand the importance. And I can say that for my child, sometimes I was so tired, I would say, can you just brush and floss on your own tonight? He'd say, no, mommy, you need to brush my teeth and floss them because I need to make sure I don't have cavities. And he would push me to brush and floss his teeth because he didn't want to be in the dental office fixing his teeth. So the first thing is make it fun and empower them. And yes, parents, we need to do the brushing and flossing for our children until about age 6 to 8, 9 years old, until they can tie their shoes, laces. That's a good age. So the second thing is the reward system. What do they love? Do they love a healthy treat, a not so healthy treat, showtime, screen time? What do they love? What can you reward them with that is within your comfort zone to give them to brush their teeth and floss their teeth? So whatever works for you, go for it. The third technique, if they're not cooperative and you need to use a little bit of restraints, just like we do in the dental office, there are safe ways as a couple that you can brush and floss, or if you are a single parent or a single grandparent, auntie, uncle, there's other techniques that you can do. So the first one is if you have a little small baby, small child, you can lay them down and just simply brush. You can use, let's see, where are our little swipes? You can use one of our little swipes. These are coconut oil, nanohydroxyapatite infused. You just grab one, wrap it around your finger, baby's lying down. You simply grab this, rub off their teeth and their gums. You can also use a toothbrush or whatever you prefer. And same thing for the child. Now, if they're not being cooperative, you can do like a gentle, put them in your little side and do like a little headlock and try to just lift up their lips and just wipe around there. The importance of lifting up their lips is that then you can see the whole tooth, and all the plaque tends to sit right here at the gum line. And that's where you really need to get when you're brushing with whatever you're brushing with. You need to get right here, brush right at the gum line, okay? And then the next thing that you can do is what's called a knee to knee. So if you have two adults, you can sit on chairs and get your knees together. So if you're sitting on this chair, if you can imagine, get your knees together and then child can lay across your legs, okay? So one parent is holding down the legs and the other parent is holding down the arms. And what you can do so you can prevent them from biting your fingers. Sometimes I take a second toothbrush and I have the child bite on that so that they don't bite my fingers. There's also bite sticks and things you can text me about if you have questions. There's a lot of products out there on the market. So while they're laying across your lap, you can use a little bit of restraint to help them and encourage them to brush and floss. And you can use floss sticks. I prefer using real floss or biodegradable floss, but there's also other options of eco-friendly floss sticks. If you have to use the plastic ones, then I recommend using it multiple times before throwing it away to avoid more plastic waste. Now, if that doesn't work, or if you're all alone with your child, what I would recommend is you can straddle the child. So you can have them lay down and I wish I had a little prop. I'll have one next time. But you can actually put your legs gently over their arms. So if these are my legs, they'd go over their arms. So their head is right in between your legs, okay? And then you can use your arms to create some restraint of their head if it's moving around. And then in that position, you can brush and floss for them. It is challenging. It is painful. It can be very emotionally painful too. But you know what? It is so important. And I promise you it will be worth it. You can read books on it to your kids. You can demo on stuffed animals. You can demo on each other. Let them brush and floss your teeth and then trade. There's a lot of things you can do. So those are just some tips and tricks. Is number 1, make it fun. Give them options. Number 2, give them a reward. Number 3, use some simple restraints with a partner. And number 4, if you're on your own, just use some restraints by yourself if you need to. But the goal is to stop using the restraints over time and encourage our children and empower them to do this on their own. So I hope that was helpful. Thank you for listening to me. I hope you have a wonderful Aloha Monday. And please, let's avoid unnecessary dental problems, okay? Let's just keep our teeth clean, keep everything clean on our own so we can avoid unnecessary trips to the dentist and avoidable cavities and dental problems. All right, message me if you have any questions. Can't wait to see you all again and hear what you think. Aloha!